Welcome to Sleep Safety. And I hear a baby. That's always wonderful noise. Excellent. Just looking at the chats a little bit, giving people a little more time. Get in here. Yes. Oh, parent of 3. Okay. Also dog professional. Wonderful. Educator in Chicago. Deborah. Nice. Jennifer, good morning. Postpartum doula, Winnipeg. Wow. Really nice. Glad you're here. Okay. Let the dog in. Parent educator, New Orleans. Welcome, welcome. Okay. Wonderful. Postpartum doula, New York City. Have a dog. Good. All right. So hopefully, I don't want to go too long because I want to get started. Welcome, and we'll let people in as they come. So I'm Jen Shryock, and I am a certified dog behavior consultant and parent, mother of 4 awesome kids. And I currently have 2 dogs. And what we want to talk about today is sleep safety. And sleep safety as it refers to, as it refers to dogs and babies, especially thinking about newborn. So if you feel free to mute, if you have questions, also feel free to unmute. This is a really relaxed conversation about sleep safety. My guinea pigs are chiming in. So a lot of times, actually, I want to go back to that. A lot of times this is the circumstance, as you see in the picture here on the front, is a dog nice and cuddled up in the bed. And that can be the situation many people have. We really enjoy, many of us, sleeping with our dogs. And a lot of our new families don't necessarily prepare for what life is going to be like once a baby arrives. And that can be a big adjustment for our family dogs. It's critical that dogs are not in the same sleep space or are managed. And we're going to get into the details of what that looks like today. So there are 5 types of supervision that we at Family Paws recognize: absent, passive, reactive, proactive, and active. Today, we're going to focus on absent and active. And proactive. So a little bit of everything. There is in our YouTube channel, on the YouTube channel, you can find the 5 types of supervision recording. And there's also this handout that is on our website under resources that you're all welcome to print out, hand out, plaster everywhere. Because supervision is the most highly recommended suggestion for new and expecting families when they have a dog. Always supervise. But I think a lot of times we need to break that down into what does that really look like. So today we're going to be talking about active, awake, aware adult supervision, which is what is essential when you might have a sleeping baby, a newborn, a baby visiting. You might be taking care of a baby. It's so incredibly important. So we run into a lot of different circumstances. Parents are tired. Caregivers are tired. And sometimes we can maybe not be watching every moment with little ones that are not tired. And so I know that I used to say to my husband, the couch is not a place to lay down, because if you lay down, you're out, you fall asleep. If he was in a reclined position, he was out. So we'd have to be really, really careful, because that is not active supervision. Once you close your eyes, once you're looking at your phone, once you're doing something else, a dog can come in the room or things can change rather quickly. And you go from aware, active supervision to not aware, right? You're distracted. You're passive supervision. Many of the families that I see still sleep
afterwards to tell me about that.
If you're able.
Okay. All right. I can do that.
We're going to.
All right. Bye.
Sorry. I'm sorry. If you could mute yourself, that'd be great. Um, and again, if you have a question, feel free to unmute, but we're going to, yeah, that's awesome. So a lot of families have the babies, whether they're nursing or resting with their baby in the bed. And I see all too often families who are still continuing to have their dogs in the bed while they do this. And that is just really unsafe. It's unsafe because if you doze off, it is absent supervision. For about 10 years, I worked with the leading expert on dog bite related fatalities. This is when accidents happen, is when there is no supervision. So it's really something that parents and caregivers need to consider strongly. It's easy to doze off, especially our nursing moms who, when they are breastfeeding and that cascade of hormones just come, fall, and you really feel relaxed and you doze off. It's something to consider. Where is the dog? And have those things in place. The other things that contribute to are dozing off at times while maybe resting with a baby could be medications we might be taking. Maybe, someone has medications for whatever reason, or a grandparent may, or a caregiver could, or maybe they take sleep medication, or, there can be lots of things. We have to consider all of this. And I want our families to think about all of this, because if there's something that could make someone doze off, like a pain medication, maybe if it's given following a cesarean or any type of thing, we want to be very conscientious about that so that we can always have safety. It's really lovely to doze off when you're holding your newborn and when you smell them and you take that in and you're rocking and everybody can get relaxed and fall asleep. We just want to make sure that we're accounting for where the family dog is, or the dogs, or the grandparent's dog, or anybody's dog. We want to make sure that if there's a dog or cat there, that we're providing a safe space. So these are illustrations that we use in our handouts. We have a sleep safety handout, and this is an illustration from Lily Chin. That's going to be a lot of our presentation today. So this is what we want to prevent. So it's really our job as Family Paws parent educators, when we first talk to our families, one of the first things we're going to ask them is, what is your plan for sleep safety, for where your baby is going to be when you are sleeping? And let's work on those plans now, so that's not a shock to your dog, so that they're used to being on the other side of a gate or behind a door or that kind of thing. This can be met with a lot of resistance. A lot of people do have their dogs in their room. If you are a postpartum doula, or a doula who goes into the home situation, this is something you want to pay attention to as well. Where is the dog when you are caretaking? And you may have questions about that. We're going to look at different scenarios, but this scenario is very dangerous. Bassinets can rock. They can be tipped over. A dog can be in a bed with the parents and jump into the bassinet. They can use the bed as a launching pad. I've definitely seen those situations, but we want to make sure the dog is in their own space in their room. So this is what this would look like. So for example, having a gate that maybe is, by a bathroom door, or the dog is in the bathroom and the baby is over by the parents. So again, we want to prepare ahead of time so that we don't have a dog that's whining, fussing, jumping, doing those things over the gate. We want to be sure that when a newborn cries or a baby of any age cries, that the parent or the caretaker is always the first responder, not the dog. So dogs get interested. They get inquisitive. They want to know what's going on. Newborn cries are alarms. They're very interesting. And it doesn't take much to have an injury or something that we want to prevent. So we want to make sure that the dog is secured if they're going to be in the bedroom. Another way to do this, but again, you have to practice ahead of time. I don't want our families to all of a sudden try to gate their dog, or all of a sudden try to use an X pen or something like that in their bedroom. If they do that, they may have a more difficult night sleeping because their dog isn't used to it. So we want to practice these things before baby arrives, right? And so that's really, really, really important. And for childbirth professionals, doulas, anybody who is in a role of influencing our families, check out our sleep safety handout. Email me if you would like. I'm going to include it in the follow-up of this class. But it's so incredibly important that we practice these things ahead of time. We don't wait until last minute for that kind of situation. Same with crating. Crating is ideal, right? It's ideal. If the dog is crated, I'm very happy. That is the ideal situation. A lot of families say, oh, we crated our dog, in when it was a puppy, and then we stopped. Crating allows you an opportunity that is really secure and safe, and your dog can stay in the bedroom with you in a comfortable way. Again, we must practice ahead of time so we can encourage that sleep safety throughout the life of the child. Crating is really fantastic because as baby grows, it's another management that is pretty safe for when a toddler is going to be able to enter the room, or a 3-year-old or 4-year-old, and the dog is nice and secure. So crating is a nice option. A Family Paws parent educator or a positive trainer is able to assist with reintroduction of a crate. They can make it a really fun time and very, very great way to have the dog safely in the bedroom, but secure. So this is another situation. As I said, I would say to my husband, when you're laying on the couch, you're closing your eyes or you're resting your eyes. It can be really tempting and easy to fall asleep. That is not active supervision. So the dog is able to go over and check out the baby. And what they might do is sniff, and the baby could be sleeping as well. But if they startle or they sneeze or they have an explosive blowout or whatever may happen, now you have some interest from the dog. And so if you're sleeping, you may not catch that. And so for safety reasons, and I don't want to go into detail, but I'm speaking about what to do based on dog bite related fatalities we have seen in the past. Okay. So this is very serious information. What we want to do is make sure that you're actively participating. In this situation, the dog is actually tethered to the person. That's one option that can be done. The dog can be tethering is where we're securing the dog via a cable or a leash that the dog's not, if they're not a chewer, but we're making sure the dog is connected with the adult, they're secured. That's another thing that can happen as well. We want to be sure that at no time, now I see a lot of videos about this on social media where it's cute to have dogs being protective under cribs, around cribs, that kind of thing. I would disagree. If a baby is resting and sleeping, we want absolutely the nursery door to be closed. We do not want access to the baby with the dog at any time. The dog, when you leave, the dog goes with you. So if you're caretaking for a baby and you need to go and clean bottles or whatever you're going to do, use the bathroom, the dog should go with you at all times. This is very, very, very important. We have baby monitors that people can use and see what's going on in the room. Closing the door is really, really, really the best way to make sure the dog or cat does not have access. And I would encourage you, for the cat lovers too, always do the double check under the cribs and under things where they might want to hang out and visit, and look around. So whatever animal it may be, ferret, dog, cat, whatever, they should always be out of the room. Here's a great example of a supervision and what we want to see. There's a dog back there, but we want this kind of active supervision where this is a person, actually this would be passive supervision. She's reading and the baby's playing, but she's in between. So I love the phrase that we have: a dog and baby on the scene, a parent in between. So that can be, you can replace parent with caregiver, with adult, with grandparent, with whomever, but there should always be an active, aware, awake adult in between. That's a given. Does anybody have any questions? I know I can just go on and on about this. It's a really important subject, but does anybody have any questions about what they are seeing in here? And I'm looking at, okay. Any questions as we go through this? No. What is the harm that can be caused by cats? Great question. We don't see a lot. I don't see a lot that cats can do, but their claws can be rather sharp. Decline is not something that we encourage. So cats usually have claws and cats can explore as well. So I've always had cats and they honestly really have taken advantage of most of the baby equipment, thinking it's like, the kitty recliner and different things, but they tend to take off when the baby's around. But that doesn't mean that they're not going to lurk underneath a dresser or someplace in a bedroom when you're going to leave a nursery or room. So what kind of arguments use when owners say that they trust their dog and are sure that nothing will happen? That is a great question. Accidents happen. Accidents happen. And I think what I would do is ask them some questions about and acknowledge that your dog is a good dog, but your dog also is a DOG. It is a dog, and a dog is an animal. And, accidents can happen just by a dog being inquisitive, using their paws to investigate, using their mouth. Dogs do use their paws. And a baby moves in a lot of different ways. So you look at dogs that might have more of a predatory instinct. So if the baby wiggles, now that's kind of interesting. And then the baby makes noise, and that's even more interesting. So I think about families that I've encountered who feel the child is going to be okay in a bouncer or a swing, right? This is something that I encounter quite a bit. And they're okay to step out. And I say, well, what if your baby spit up? Might that be of interest to your dog? What if your baby startled? Where they have that reflex and go like that. Wow, that can go from really sudden, boring to interesting in a heartbeat. So, and is it worth the risk, right? So if your dog, taking your dog with you is the safest thing. So even good dogs can be inquisitive. Even good dogs can be playful. Even good dogs can injure without it being aggressive or malicious. In fact, I would say that the situations in which we usually see incidents with toddlers and, well, toddlers is a different story, but with babies and newborns, it's usually inquisitive. I wouldn't necessarily call it aggressive in a lot of cases, some cases for sure, but in a lot of cases, no. So, it just depends, but it's really important to take the dog with you when you're moving to a different place in the house. I remember take the baby with you. So I used to do a lot of baby wearing, which was really helpful. But I also remember carrying a bouncer chair. When I would take a shower and that bouncer chair would go, I would pick it up or, place that and then put my baby in that in the bathroom when I was in the bathroom, and I would lock the dogs out, or I would have the dogs behind a door. I had 4 dogs at the time that we had our youngest. And they were all rescues. They were large dogs. And we had rules for each one of them. Each one of them had their own, what I reference as success stations. So being behind a gate is a success station. It's where our dogs can be successful. They're not going to interfere with a child who's playing on the floor. They're not going to get any of the toys. They are safe, and we know that they're in their success station. That's really, really, really important. I mentioned crating before. Again, that can be really helpful when you have, for example, a visiting, a child care provider in the home. If you are a doula, crates are your friend. You are there for the baby and to take care of other things. You're not there for the dog. So having that option is really, really helpful if the family has that in place. Okay. I hope that's really helpful with some of the examples, because, and feel free to ask questions, feel free to unmute. So what we are looking for all the time is active, awake, aware adult supervision. I think there can be a lot of confusion about what supervision is, and you can be watching and then doze off. I remember very vividly with several of my newborns, holding them and just being so exhausted, tired as they nursed, that I would just doze off. And we have to think about that being, could the baby fall? Is the dog in the room? Are you aware of what's happening in that moment? It's something really that we need to think about and consider. Okay. Is there a question? I hear somebody. Okay. Surprisingly, being awake and aware. When can we be comfortable to have a pet near a baby? Okay. To coexist safely. Seems most people let a dog interact once babies are at the crawling stage. Oi. Yeah. So, it's really, I need to use my magnifying. Kaylee, I believe I would love for you to unmute. That's a fantastic question. If you're comfortable unmuting and talking about that a little bit, it's a great question. So yeah, go ahead. Do you want to?
Yeah, so hi, I'm unmuted.
Fantastic.
I've currently got a newborn who's 2 months, and I've got a puppy who's 8 months.
Wow.
He's super curious, and he does make me nervous, so naturally I want to protect my baby, of course. But you do see the videos online, of course, and you hear all the success stories of, oh, they were the best of friends, and, once they started crawling, the gates started to come down, and people, I guess, let their guard down eventually, or, some degree of supervising. Sorry.
Yeah, I hear. Yeah.
So it's just kind of wondering how you build that trust to eventually have more coexisting, right?
So one of the things that we encourage, so I'm really referencing sleep today. And so when a parent or is asleep, we want to make sure that there's safety. But we do encourage inclusion of the family dog. So if you look at our different types of supervision, we really encourage that we're using proactive supervision in a situation where the dog is able to constantly observe and see and be a part of daily inclusion. We want our dogs to see what's going on, but we want to make sure that there's a barrier in between, right? So when you have, and I hear what you're saying, that a lot of people take those gates down around the crawling stage. We want gates to come up at the crawling stage. That's where our dogs really have difficulties with babies. So it's very common for people to think that their dog and baby have adjusted really well, but then we hit a new milestone where the baby's facing outward, or the baby's crawling and sitting on the floor, and the dog thinks that the baby is engaging in play, and that's not really what they're doing. And the dog has their doggy way of playing with their teeth and their paws, and that's very dangerous and uncomfortable. We want to step up management. In fact, we have a dogs and toddlers webinar that focuses on that. We say it's for babies age 3 months to 3 years, because what we're encouraging is the introduction. If it's not already in place, if there's already not success stations in place, we are going to encourage that they are put into place around that 3-month age of the baby, because crawling leads to a lot of dog bite incidents. There's miscommunication between dogs and babies that happens very naturally. And so, I know there's a lot of videos out there and a lot of things on social media that'll have puppies and babies all together. We want to be very careful about that. Again, the potential for miscommunication is really common. And so we want to make sure that there's a divider in between. So I always say a dog and baby on the scene, a parent in between, and especially during the toddler time. So, but the dog is included. They might have an enrichment toy or something to do. We use a lot of enrichment, and I can't get into everything in this like half-hour presentation, but which we'll go over, of course, go over time. I mean, but we want to practice using the gates, the crates, the X-Pen, all these different things, so that the dog is able to be around and in the vicinity, but they're in their own space enjoying something that's of value for them. Does that help at all? It sounds like you're seeing a lot of dogs and toddlers that are, and babies as they grow, interacting with the dog physically. I was just curious.
Yes. Yeah, that's just kind of, I guess, the culture, I suppose, that you see, and eventually I suppose it's what you strive towards,
Sure.
harmony, safe, harmonious interaction of some kind.
I absolutely am with you on that. And so what I would suggest is that, so when you have a crawling baby, right, what happens is the dog might be laying in a spot and the baby's crawling, and the dog is going to offer body language that they would give to another dog. The challenge comes in that our babies don't recognize that. They're learning our language, and so they crawl towards the dog. And a lot of dogs really get uncomfortable with toddlers being at their direct eye level. So we want to make sure that those kinds of situations don't happen. But what we want to do is play games where the parent is, for example, holding the baby on their lap and maybe tossing a treat for the dog to go get. So they're engaging in different things, but they're not on the same floor playing, that kind of thing. We want always parent-guided interaction and structure to it, so that there's expectations of the dog and expectations of the baby. Does that make sense?
Yes, absolutely. And I do appreciate you taking me, or taking the time, even though I do apologize for going a bit off topic there.
No worries.
I really appreciate it.
Absolutely. Does anybody else have any questions about absent, passive, reactive, proactive, or active supervision? Is that helpful? Is that helpful information? It's so incredibly important when it comes to sleep. Still supervising and being awake and aware. When can we be? Is that the same one? Okay, that's Kaylee. During pregnancy, when is a good time to begin helping your pet learn about success stations? Oh, anytime, before even you're expecting. So it's funny because a lot of people get rid of their crates, and I've always had dogs that love their crate. And so we've continued to have them throughout the life of the dog because it can be really helpful for management, especially when you have children or you have visiting children and things like that. So there is no too soon to begin preparing for whatever success stations you're going to be utilizing for your particular dog. You may not meet parents until they are very late in their pregnancies. That's very, very true. So in those situations and cases, what we want to do is try to utilize the least stressful management for the dog. Again, I think having varieties of X-Pen play yards, lots of things. So for example, if I have a dog that has never been behind a gate before, and I have a newborn parent who's calling me and the dog is reactive, we may use a play yard that can go around the parent or the caregiver as they're holding a newborn, right? So that the dog is on the other side of it and not able to get to the person. Maybe they're really excited to check things out. Maybe they are very inquisitive and that kind of thing. So we can do things like that, like instantly, you know. So play yards are really helpful because they have different, 8 panels or X pens, dog X pens. I encourage caregivers, doulas, to consider keeping one in your car in case you need one. It might be handy and helpful. They're fairly inexpensive and people give them away all the time. And if you're a dog professional, having the examples of management to set up for families immediately so that they can have something temporarily until they can purchase it is really helpful and a great way to get buy-in. I don't know if that helps that question. Parents want babies and dogs to bond and have an amazing connection. So yes, often put them in situations where dogs are uncomfortable, but we don't always know how to read the dog. This is very true. I would say that it's a natural occurrence and natural feeling for all of us to want harmony. When you get a dog and have a dog and child, I remember someone sent me a picture. I was president of German Shepherd Rescue, and that's where I got a lot of experience with a variety of dogs coming through my house. And I remember a photo being taken of a newborn laying right next to this big German Shepherd pet. And I thought that's what I want. That is precious. Look how cute that is. And I recreated that situation when my newborn came. I put her right next to our giant German Shepherd head, and she was laying there. And looking back now, he could have flipped his head around and, just turn his head out of interest. Any number of things can happen. Not to mention, do we know that newborns are actually comfortable next to predators? Do we know that? I don't know that we do. We don't know that they're uncomfortable or comfortable. That's something that I have a lot of question about when it comes to newborns being close to dogs is, could it be creating a fear response in that child? I don't know. I don't have that answer, but I do see a lot of videos with very young babies where dogs and puppies are crawling on them in their bouncer seat. I saw one actually this morning, and the baby's grimacing and making faces and making noises, and it does not look happy, right? So we want to consider the comfort level of both the dog and the child. And we don't want to inadvertently create fear. So that's a consideration too. So dog and baby on the scene, a parent in between allows that there is safety in between and the dog is included. Now we have 2 different programs because we can't possibly cover everything today. And I really appreciate that you all came just to get a taste of what I think is the most important, is making sure that there's awake, aware, adult, active supervision anytime there's sleeping happening. But in our dogs and toddlers program, we cover a lot of things helping families prepare with their dogs for life with toddlers, which is usually an afterthought. We want it to be in the forefront of people's minds. We really don't like to have the situations where there's been a nip or a bite to a child. And we believe that the material in our program really can help prevent a lot of those situations. Dogs and Storks is for new and expectant families, and that covers preparing families with dogs for life with baby. It is for grandparents, parents, caregivers. It's for anybody. It is a really great way to become a little bit familiar with dog body language and how to set everybody up for success as they prepare with their dog. Okay, I see another comment. Excellent. Well, I really appreciate you for coming. And we do have a dog and baby support line, which is for anybody. It is for professionals who have questions. It is for families. It is for, we get calls from people who they just had their baby and now they are concerned, right? That's a really common call that we get. We do respond within 24 hours, usually within hours. If there has been an incident, that's also a support line for someone who has a toddler that has experienced a dog bite or a growl. We handle many of those calls, and that's what we're trying to prevent. So, okay. If you have any questions, if you are a childbirth educator doula, we offer Dog Aware for professionals, and that is for, it's on our website. And there is no fee for the support line. If we do refer or feel it's a situation where we need a consultation, then you will work with the individual professional's fee structure. But for the questions and immediate support, there is no fee for that. That is a free service that we offer and have since 2008. And we've learned a lot through the types of call we receive. I can tell you, usually it is a newborn parent who is newborns or 8 to 10-month-olds are the consistent ranges that we get on our support line. Yeah. But if you are a professional, if you're a dog professional, we offer a 13-week course. We also offer a Dog Aware for dog professionals, Dog Aware for birth professionals. And if you have any questions at all, you can always reach out to the support line. But I really appreciate you all coming. This is very important information, and it saves lives, to be honest. It really is. Those of you who are interacting with newborns have an opportunity to present this information to your families. So I will include in your follow-up email the sleep safety handout and the 5 types of supervision. And please feel free to reach out to me at any time. familypaws@gmail.com. It's really easy, but I'll put it in the chat. You have my email. It came with the information. But thank you all for attending. I hope that was helpful. There's so much we could cover. So I just wanted to give you a taste of safety. All right. I appreciate you all. Have a great day. Reach out anytime.